Hi there, today I'm welcoming Emmanuel Mankura from Kenya. So, thank you for coming in to see me today.
Thank you so much indeed.
Can you tell me a little bit about yourself?
My name is Emmanuel Ole Mankura. I come from Kenya, from a Maasai tribe. In Kenya we have over 42 tribes, and I come from a tribe called the Maasai people, who are nomadic pastoralists. We live in the southern parts of Kenya and in the northern parts of Tanzania in East Africa.
Great,
yes.
Thank you. So, you were telling me that you'd been to see a doctor about the lump in your neck. Can we have a look at that?
Yeah, okay.
Oh, it's quite a large lump, isn't it? The size of a squash ball.
Yeah.
And what did the doctor tell you?
My doctor told me that this is cancer. You know, I went to, and they did a biopsy. They told me that it was a cancer, and it was really scary about how they do the treatment. Because they said they had 3 ways of doing in the hospital. Therefore, I went back to the village and met a doctor there, traditional doctor, who told me that these things are brought by, chemicals which get into the body, into the system, and what we need is to purify our system.
Right.
Therefore, I should avoid, taking sugars, many sugars in the food. The sugars that I should use are just natural sugars that are found in food, and I avoid so much sugary food. Therefore, since that time, I stopped using sugar in my tea, and therefore, and also he told me I stopped using a lot of cooking fat, which have been manufactured from the companies. All the company foods I do away with. I do the natural food. I eat the natural foods that are produced in the village. Yeah. And for the last 6 years, I was diagnosed in 2009, and up to now I'm still going on.
That's great to hear.
There's no big problem.
You're still alive, and
I'm still
very
alive.
Much fit.
I just want to tell you that different fruits like carrots, beetroot, and the greens, you see, especially the wheat, when they get into the body, they confuse diseases which are in the body. Therefore, they retard the harshness and the vigor of those diseases, or that power of killer diseases. Therefore,
so the different colours, as in the orange of carrots, the green of vegetables, the red of beetroots.
Yes, especially beetroot and carrots are very, very good.
So, recently the Journal of the American Academy of Medicine reported a study of 31,000 Americans, and they found that those with twice the sugar intake, this is irrespective of size, race, fatness, fitness, those with twice the sugar intake had twice the risk of dying of heart disease. Now this is really important. Bear in mind that 60% of men die of heart disease. More women die of heart disease than breast cancer. It's huge, this information. What we're finding is that it's fructose. Now fructose would seem healthy. It's the sugar in fruits after all. However, fructose is in corn syrup, and is the thing that's used in fizzy drinks, in yogurts, in bagels, anything processed, any processed foods. As Emmanuel said, they're not healthy. Man-made foods are not healthy. And this fructose is the killer. What it does, it is disturbing the cell's mitochondria. Mitochondria are the powerhouses in the cell that do everything, the little batteries in the cell. And it also damages our liver because they're broken down rather like alcohol and made into ethanol, and damages our liver. Secondly, they're found to be a cause of cancer. Uterine cancer in women, it was found, a study in Finland showed that they had a 78% increased chance of getting uterine cancer when they had a high sugar diet. So we don't like saturated fats and we don't like sugars. This is going to be the cause of your cancers, of your heart disease. There's more and more we're finding out about good diets and the importance of good diets. What can you eat though? Well, if you've got a sweet tooth, I recommend dates, I recommend figs, perhaps honey. Fruits, whole fruits are fine, but just not fruit juices, because of course they don't have any fibre of the fruit and they tend to have a lot of fructose in them. Thank you very much for sharing this story.
Yes.
We've talked about the health aspect, and I think you've given us some really interesting traditional wisdom about the evils of sugar and refined diets. That
Yes.
only now in the West we're becoming to realise that this is the cause of all our major diseases, such
Yes.
as heart disease and cancer.
Mm.
I know that you're talking to the Royal Geographical Society about business in
Yes.
Hong Kong and other aspects, so
Yeah.
I'm hoping that a lot of our viewers can come along and see that.
Yeah, I'm looking forward to it.
Us too, thank
Sure.
you.
Yes.